All set. Welcome, welcome, welcome. Welcome to Medical Mondays with Dr. O. We're here for another exciting evening. I am Dr. Toyin Okwesomi, a medical doctor in Maryland. I am a family practitioner, HIV specialist, who also treat addictions. I'm always excited to come on Medical Mondays with Dr. O because I learned so much on this forum. And tonight, we have the privilege to have one of our very own come back tonight, Dr. David Ajibade. He's going to talk to us about something very important. And during this conversation, I'm going to try to take a poll, which I'll share with you at the end of this conversation. Because Alzheimer's disease and Blacks that Dr. Ajibade wants to talk about is very, very common in Black people. In this talk, he will be presenting what he calls Dementia's Dirty Dozen, the 12 major causes or pathways to Alzheimer's disease. And the best part of it is that he's going to share with us what we can do to avoid this track. So without much ado, I'm going to bring on Dr. David Ajibade. Welcome.
Hello, good evening, everyone. Thank you, Dr. O. I really appreciate it for this privilege of being able to talk about this all-important topic. Should I proceed? Or...
Yes, please.
Okay.
Let's
play around with this thing a little bit. Okay. All right. Well, good evening, everyone, and again, excited about this topic. Let me see if I can go ahead and share my screen. I'll have to find out which one it is. Okay, I think it's this one. No, this is this one, right? Yeah. Okay. Again, thank you for the privilege of being able to share this all-important topic. So we're going to go through a few things, and please feel free to type in your questions at any point in time, and then we shall. Dr. O, however you want to do it. If you feel you need to interrupt me, that's perfectly okay. So I have in front of you a picture of two brains: a healthy brain on your left and a diseased brain on your right. Same here: normal brain on your left, diseased brain on your right. And then we split them into two: healthy on the left, diseased on the right. Same here. By the time the Alzheimer's disease brain looks like this, the individual, to all intents and purposes, is non-functional. For the most part, she's probably unable to speak, unable to feed himself or herself, unable to clean himself or herself. Probably has pads. What do you call it again?
Pampas.
Pampas, yes, sir. Thank you so much, Dr. J. Probably having Pampas on 24/7, and eventually, to all intents and purposes, the word vegetable is rather derogatory, but that's a picture that comes to mind now.
Incontinent.
Incontinence, that's true as well. So unable to speak, and usually people with Alzheimer's disease eventually die most frequently of infections, usually of the chest, of the lungs, pneumonia, as a result of the fact that they are even unable to swallow their saliva. So their saliva drips into their lungs and it causes infections and reactions and inflammation, and eventually the individual dies. If not for that, that brain will continue to shrink and shrink and shrink and eventually damage the centers that are responsible for breathing and for heart rate and for circulation. And that's what will eventually kills a person. So dementia is not something to sneeze about. It is a progressive, the word is progress, it's a progressive disease that will not stop until the individual is dead. So it's super important that we are, as Black people, and I'm going to get into why we are especially prone to having dementia, but it's super important that we understand the tracks, the pathways that lead to dementia, so that we can start taking the small steps or large steps to get off those pathways. So here's some sobering statistics. I'm not going to go through all of them, but 6.5 million now is going to double, more than double, probably by, some say by 2050, it's going to be double. And then, of course, it's spreading all over the world. We're beginning to see more and more cases in Nigeria. I mean, we think, when I was in medical school, we only thought about Alzheimer's disease as a problem of the very, very old and decrepit white person. That was all we thought about what dementia was. Interestingly enough, so the same thing was autism. We always thought autism was a white person's disease. Now we're seeing that is not the case. So it is getting worse and worse, not just in developed countries, but also in our country, Nigeria, and other African countries as well, third world countries. And it's getting worse, much worse amongst Black people. As we see here, it's twice. If you're Black, you're twice as likely to have Alzheimer's disease. If you're a woman, you are 2 to 3 times more likely to have dementia than men. And if you're, of course, military veterans too, we're not going to talk about that today, but they also have their predisposition. They are more prone to having it. So most of the people here on this call are women and they are Black, I would guess. So extra, unfortunately, you're at an extra higher risk. So the Black woman has an extra higher risk. Living in the United States or living in a developed country has a highest risk of developing dementia. By the way, in the UK, it's not publicized now, but in the UK, dementia is actually number 1 cause of death in the United Kingdom. Imagine that. All right, so let's see what dementia is all about. So there's a lot of words that are just used to just throw around and talk about this. I'm not going to read it all out. Let me see if I can just get something that's simple. All right. So I think I kind of mixed the slides up. But dementia primarily, folks, is a problem in which your brain is not functioning to the extent in which you can perform daily activities. The most obvious thing is memory. You're forgetting things that you normally do not forget. But it's not just about memory. It's also about your thought processes, your ability to understand what someone is saying and to respond. Many times, in fact, most times, it also has to do with your mood and your behavior. You're unable to control your emotions. You get frustrated, you get confused, you get anxious for no reason at all. Those all come part and parcel with dementia. But what most people talk about is memory. That's why you hear about the assisted living memory centers and all that. To me, I think it's a mistake that they just focus on memory alone. I think there's a lot more to it than that. So here are about 10 warning signs, and we can make these slides available in the future. So memory, thinking, processing, mood, changes in behavior. I just want to take a quick pause here to say a little bit about myself. As Dr. O says, I'm a doctor. I run the Brain and Body Foundation, which is based both in Nigeria and the US. But one of our passions, and we started with children, our passions was finding out how to treat or address brain disorders in third world countries where we don't have access to fMRIs, CT scans, PET scans, and all the wonderful gadgets that you all have in the US and other developed countries. Because we saw that it was even worse. Brain disorders were worse in African countries. So my passion and our goal is to find the basic things that you can do to address brain disorders in the absence of all these other experts, establishments, and so on and so forth. And we found out that a lot of it have to do with, yes, lifestyle, but also nutrients, specific things that can help the brain repair itself, help the brain fix itself. And we're finding out, and like I said, I'm going to get to this soon enough, but we're finding out that Africans, people of Black origin, people that look like me, tend to be lacking in the nutrients that keep the brain healthy and strong, as opposed to white people. Is it that somehow we've been cursed or somehow God doesn't like us? No, but we'll talk about that a little bit more. I'm also with the Alzheimer's Association is the number one after the government, after the NIH. I think they're the number one funding organization for Alzheimer's research in the world. So I was fortunate to be accepted on there as a community health educator. As I was saying earlier, we were focused on children at first, but when we started getting good results, we went to the government of Nigeria and we told them, we showed them our results, and they granted us permission to use our unique approach to addressing these disorders in children. But then as our success continued, older people who are not kids, started coming to us with problems like strokes, problems like dementia, problems like memory loss, and just inability to process well. And so we began to help them too. So we again went back to the government to get permission to use our approach. It's called the building strength approach to address these conditions. And we do a lot of telemedicine. So even when I'm in the US and in Nigeria, or whether in Nigeria and the US, we're able to see, to address patients, but I'm licensed in Nigeria. So we're able to look at these things as we go along. So let's talk about the pathways now. So we know that dementia is a progressive thing. It starts really in mid-age, and that's when the major damage begins to happen. Doesn't mean that it doesn't start earlier than that. So mid-age, from your 40s onwards, is when when the real damage begins to build and build and build. By 65, on average, is when the signs really begin to show up. Memory, like I said, memory problems, mood problems, unable to live independently, forgetting to pay your bills, missing your way home, not remembering who your wife is, not remembering who your kids or your grandkids are. Those are when those things begin to start showing up, but it does not mean that that's when the problem started. It's usually 20 years plus that the problems began. And so what we found out is that, let's see, okay, so I just want to say this real quick. It's a combination of things. It's a combination of insults, whether primary, then secondary insults, then even tertiary insults. So for instance, you're diabetic, and then you have high blood sugar, then you take medication, which was meant to address the diabetes, but also has its own side effects. Sometimes it causes hypoglycemia, where the blood sugar drops, that causes damage to the brain. Sometimes the blood sugar fluctuates. Then there's also the factor of your brain and your body itself reacting to the disease or to the illness or to stress. So your body reacting by inflammation, that in itself is another insult. So you have the initial illness, you have the drugs, and then you have your body's reaction to the illness or to the insult. So it's a period of insult plus time plus insult plus time. Eventually the brain says, "You don't do, I'm tired." And the brain begins to shut itself down. That is what separates Alzheimer's dementia from any other kind of dementia. Because in the case of Alzheimer's dementia, it's not just about the plaques, amyloid plaques, and not just about the tangles that we all hear about. Yes, those are the signs, the signature of dementia, of Alzheimer's dementia. But in addition, they have found out that it's actually the brain, the program in the brain that has been set off, that is slowly shutting itself down. It's putting back on the connections and the circuitries, and it's shutting the neurons down in a progressive manner. In fact, they can even see that it starts with a part of the brain and it spreads, and you can see it's almost like a predictable manner how the brain shuts itself down. That's not as publicized. All we hear about is plaques, and certainly not to discredit that theory, but it's not just about the plaques. Actually, the brain shutting itself down in addition to the plaques and the tangles. So let's look at some of the causes. Obviously, we don't have time to go through all of it tonight. I'm just going to touch on a few things. So I mentioned illnesses like diabetes, hypertension, heart disease, atrial fibrillation, autoimmune conditions, inflammatory conditions, and so on and so forth. We tend, as Black people, to have much higher rates of diabetes and hypertension and heart disease. And I'm going to come to a point where we talk about why heart disease and diabetes are so key to the development of dementia. Hopefully, I'll be able to explain that. Inactivity is a big thing, whether it's mental inactivity or physical inactivity. Well, our bodies were made for movement, and the less movement we have, obviously, as we grow older, we don't move as much. The less movement we have, the more the brain suffers as a result. All right. Interesting thing about insulin resistance, there's a lot of research coming out, but let's talk about number 9 briefly. We are now seeing, we've talked about, we know there are viral infections, we know there are fungal infections that kind of like live in the teeth or live in the sinuses, and over time kind of affect the brain and cause damage. But most prominently and most recently is COVID-19. They're seeing that there are a lot of people who have had COVID-19 who maybe were on the brink, maybe having some small problems with their memories. It seems that we're seeing more and more who have had the infection or had suffered from COVID, either mild or moderate or severe. And eventually, it seems like there's an acceleration of dementia amongst many people who have had the infection, especially the older people. They're seeing it too with the other thing that's causing so much controversy now, so I'm not going to mention it, but it starts with a V. We're seeing different things coming up. And so this period, it has been really, really, really interesting times. And so again, super important. So why do Black people have it so bad? In summary, we have the most frequent and the most, bottom line is that the attacks on our brains, and everybody has attacks. Everybody is being assailed. Everybody's brain is being assailed by all kinds of things. We've mentioned illnesses, with their infections, their air pollution, everything, personal care, hair care, hairspray. It seems as if we're, for different reasons, including poverty and health illiteracy, for the most part, it seems that we're allowing or deliberately doing things that are affecting our brains the most. We are also, for different reasons, including genetic reasons and probably lifestyle reasons, we also seem to be have the least protection. And to cap it all up, we're the least likely to go to the doctor when there's a problem. Men worse than women, but nevertheless, we as a race. And interesting that I've seen it because in Nigeria, we used to think, oh, it's just an African thing, but we see it over in the US as well. We see Black Americans not wanting to, not being as apt to go maybe for treatment of a mental health problem or depression or anything like that. They're not as apt as their white counterparts to do it. So those are the 3 things. There's more, we have greater attacks, we have less protections, and when we begin to have problems, we are least likely to go and see the doctor. So I have in front of you a picture because it's basically under siege. We are all bombarded by everything from chemicals to EMFs, emotional stress, depression. EMFs means electromagnetic frequencies, bacteria and viruses. So everybody, and the longer we're in this world, the longer these things build and accumulate upon themselves. And even in our bodies, we're creating toxins as well. So it's a combination of several things. And again, we don't seem to have, or we're not doing enough or as much as the other races to protect ourselves, either as a result of culture, lifestyle, so something to do with our genes as well. So there are about seven things that I've seen. And I used to have, actually in Nigeria, my TV show, which we're still doing now from here, is there was a series I did called Why Blacks Die First. And we went through a series of different things and tried to explain why that was an issue. I'm just pointing out a few things. Genes and data are the main thing I want to talk about. Access to healthcare, obviously, there's the issue of health disparities. The racial thing is still an issue. Sometimes they treat a white person, they do run all these tests, treat a Black person, they don't run as many tests. is still an issue that is constantly being addressed, and we hope that there's going to be parity eventually, but we can't wait until that happens. And once our discussion starts, it's just a discussion. The important thing is to understand what you have control over and don't stress what you don't have control over. And so it's important that you understand what was that prayer again? Lord, grant me the serenity to know the things that I have control over. Dr. Ajibade, do you remember that prayer, to know the difference between what you have control over and what you don't have control over? Anyways, I know that it was one of these saints that had it. Okay, so the environment is very important too, pollution, lifestyles. Dr. O, any questions, anything you want to point out to me as we're talking?
No, we'll let you finish, and then I'm jotting down my questions. Thank you.
Okay, great. All right. Let's talk about the genes. What we know in summary is that we Blacks are more sensitive to sugar. We're more sensitive to salt. And we also seem to be more sensitive to calcium. So just quickly, let me just throw this out here. No extra charge for this. Do not take a calcium supplement if you're Black. You don't need it. You don't need it. Don't take calcium, please. Pico, Ejo, Do, please don't take a calcium supplement. Why else do you think that the most popular drug for hypertension is a calcium channel blocker? Because we don't do well with calcium as much. The other thing, obviously, we know salt is a deal, and we know sugar. But there's another thing that I want to talk about too, vitamin D. We have the least amount of vitamin D. And people, when I say this, people are shocked. I mean, I was at this, the National Broadcasting Corporation, I was the guest speaker there, and I was talking to these are the highest ranked people in the whole National Broadcasting Corporation in Nigeria. And I was talking about why we have less vitamin D, and afterwards, high up person, they come to me and they say, oh, but we're Black. Shouldn't we have more vitamin D because we're Black and we have more sun? And first of all, I was shocked. But then I realized that what the individual was saying was that because of the dark, because we come to believe that the darker the color is, the more you absorb heat. So they were confounding the two, thinking that heat is the same thing as light. But we're not talking about heat when we're talking about vitamin D. We're talking about light. We're talking about rays. We're specifically talking about ultraviolet B rays of the sun. You have to have direct, not through the window, not through the mirror, not through your clothes, direct contact of the sun's rays onto your skin. That and only then, that is the only way that your body is going to produce vitamin D. Without which, you can bring in the sunlight in all of its glory into your house. And if you are fully clothed, you're not going to get vitamin D. So what vitamin D does, amongst other things, is that it helps with the cardiovascular system, it helps with the blood flow, it helps with the heart, and also it helps with the immune system. I mean, it does so many things. It even helps with the genes. It helps in the repair of cells and in multiplication of cells. So vitamin D is very important. It is also extremely important for the hippocampus, which is the memory center in the brain, amongst other places. But it's extremely important for the protection and the health of the memory center of the brain, which is the part that is most severely affected in Alzheimer's disease. So the bottom line is this: if you're not having enough vitamin D, you are at a higher risk of having brain damage. So back to my point about us not having enough protection, where our lifestyles are making us more prone to, and our diets are making us more prone to attacks, but then things like vitamin D, we're not having enough of. There are other things as well, like vitamin B. In fact, they're saying that some people are saying that vitamin B should be called the brain vitamins, B for brain, because there's the B1, B9, B12 especially. The others are important too, but these three most important are important for brain function and for brain preservation. We're not getting enough of that. We're not getting enough of magnesium. Another thing, potassium. These are basic things that I wish they would be shouting about, but we're not getting enough of it. So, I'm talking about, I kind of moved to lifestyle, to diet now. So it's diet. We're just not getting enough of it in our diet. I mean, the general population, things like vitamin B, magnesium are lacking, and potassium, but they're saying that African Americans, in addition, are not, they are at a higher, their diets or our diets are not, they are even less containing of these vital nutrients. Now I'll list them at the end, but there are about 7 nutrients that they are saying that are super important for the health of the arteries and also the health of the brain. These are basic things. Now, on top of that, and what we do with our foundation too is, on top of that, we look for specific brain nutraceuticals, and we use them. We use them in our treatment and management of patients, but you've got to start with the basics first. And these are the basics. All right. So what do we do under this? I think the question we have to ask ourselves, this is a common sense question as far as I'm concerned, or there are 2 common sense questions. You've got to understand what makes your brain stronger, and number 2, what makes your brain weaker. I think it's even more important to understand what makes your brain weaker so that you can avoid them. Again, back to the dirty dozen, basic things like sleep. Most people sleep with the light on, the TV on, there's noise, the phone is near their head, under their pillow. There's a lot of things just attacking your brain when you're going to sleep. You don't sleep with you probably should take a shower. You should take a shower before you go to bed. You should brush your teeth. You don't want to eat too late into the night. All these different things. Well, if you don't have good enough quality, uninterrupted, long, deep sleep, guaranteed your brain is under attack. So it's really important that sleep is a big thing. And again, there's just not enough time, but so there's an entire series of things that we talk about with regards to the brain. Obviously, what makes your brain stronger? Movement, the right diet. Again, I'm not minimizing having a balanced diet. You should have a balanced diet. But what I know about most balanced diets is that they don't have enough of the basic things in the right doses. Well, like we're now finding out that you need at least 3,000 milligrams of potassium now. Nobody gets that. The most supplements only have 100 milligrams of potassium in their things. But you check it out. We're now seeing that potassium is very, very lacking, especially in the Black community. So therefore, having said all these things, what is your responsibility as an intelligent, upstanding member of society that wants to live to 80 or 90 at least in good health? Your one mission, in my opinion, should be to protect your arteries. I didn't say protect your heart. I didn't say protect your cardiovascular system. I didn't say protect your brain. Are they important? Are they not important? Absolutely. But if I'm to focus on one thing only, it has to be the channels that take blood and therefore that take oxygen and nutrients from your heart to your brain. If those channels are compromised in any way, which is what happens as we grow older, everybody's channels have become kind of like get blocked, get stiffened to some degree. To that extent, your brain cells will not be nourished as they should. They will not have the oxygen they need to function. And of course, as you know, the brain needs a lot of oxygen. I think a quarter of all the energy and oxygen is used up by the brain that comes into your body. So your priority, your number one function is to ensure that your arteries are healthy. And there are some tips that I can say to add to that. But before I get to the tips, I attended a seminar once, and these were histopathologists. These are the people who look at the tissues of the brain. They were neurohistopathologists. And one of the things, they said a lot of technical things, which I'm not going to bore you with. But the thing that really, really stood out to me that they said that I don't think I will ever forget for the rest of my life. One of the histopathologists said she has seen at autopsy brains that had a lot of plaques in them. But at the time of death, they showed no evidence of cognitive decline. They were thinking, they were functioning. normally. There was no memory issues. There were no memory issues. They also said that they have seen brains that have had both amyloid plaques and have had tau tangles, all the signature things that you see in Alzheimer's disease. And even then, those did not have any signs. They've seen brains that did not have any signs of cognitive defects. However, they have never, and this is what the histopathologist was saying, they have never seen a brain that has tau tangles, amyloid plaques, and evidence of vascular arteries being damaged that did not have dementia. So the key there is the health of the arteries. It seems to be, and people are saying, well, is it the chicken or the egg? Is it the arteries that cause the plaques, or is it the plaques that cause the arteries? At this point, that's not the important question. The important thing that you want to take away from this is that you've got to keep your arteries healthy, especially the arteries that are going to the brain. Obviously, you can't select which arteries you're going to keep healthy. What you can do is to ensure that you are taking the things and you're doing the things that help to maintain healthy arteries. And so you have pictures of the of blood vessels. There are things, you don't just develop atherosclerosis, you don't just develop blockage in your arteries just like that. There are things that you're doing or the things that you're failing to do that is causing this to happen. And so what we're trying to do, again, this is a progression. So you can see this is normal on the left, and you can see the progression happens. You can have as much as 70% blockage of an artery, and you won't have any. It can be in the brain, it can be in the heart, it can be in any other organ. You won't feel a thing. So you can have 30%. Just that 30% can be available or can be patent, and you would still be functioning normally. But we don't know when that 30% will just get blocked. So it's important. It's important. And I say this because, again, we primarily operate in an environment in which we don't have access to all this, the calcium, coronary calcium scores, the PET scans, the CT scans, all these wonderful things everybody takes for granted. Most Nigerians don't have access to it. So what we can say and what we try to emphasize is you've got to start doing the right things. So number one is everybody should have a blood pressure measuring device, please. These things are dirt cheap. I should be checking it regularly. I have one every time I sit down. I'm checking my blood pressure. Again, I'm taking my meds. I mean, I have to take amlodipine now. I mean, imagine that. I never thought I would ever get it when I'm taking amlodipine. But I take it, but I also do the things I'm going to advise you to do as well. Because blood pressure medication is not enough to keep your blood pressure, to keep your blood vessels healthy. They can reduce so having the right blood pressure will reduce the damage being done to your blood pressure, to your blood vessels. But that's not enough. It doesn't mean that you are also giving them, but you have to also give your blood vessels the nutrients they need, or arteries, the nutrients they need to be healthy and strong. All right, take your meds religiously. If you have high blood sugar, please take your meds religiously. Those are the two topmost things that can cause damage to your arteries. Don't joke with it. Don't play around with it. Take your medication, please. The other thing, we Africans, we like starchy food, we like fried foods, we like carbohydrates. Those things convert to sugar really, really quickly. My advice is just reduce your portion reduce it by half for starters. You will find out that you didn't really need all that food in the first place. You can just take half of it and bring it to a third. You want to eat your meat, but reduce your starchy intake. There are 7 supplements that I talk about all the time that you really should stay. I've talked about them already. So vitamin C, vitamin B, vitamin C. Vitamin C is super important for the blood vessels. Again, blacks are lacking in this, probably from our diet. Vitamin D3. Vitamin K2, almost nobody talks about, but it's now beginning to get more and more publicity. Vitamin K2 is, in short, K2 is what K2 does is it takes the calcium out of the blood and pushes it into the bones. So it combats things like atherosclerosis, because once you have too much calcium and fibrin, it can cause thickening and hardening of the arteries. I mentioned potassium. They found out that potassium too is important to prevent atherosclerosis. Magnesium is important to relax the blood vessels. Zinc too is important. I put zinc here, not because of the arteries as much, but because of the brain. Zinc is the most important nutrient for the brain, the most important mineral for the brain. And of course, fiber helps control your blood sugar. It does a lot for your blood vessels, but it also is important for brain function. Maybe we can get to that later. So number 5, please, as soon as you begin to see problems going on, take advantage of your insurance if you have it. Go and see the doctor, for heaven's sake. Please see the doctor. All right, so in conclusion, I think time is far spent. The numbers are going to continue to increase, but we're seeing that the increase is greater in developed countries, in developing countries like Africa. The rate of increase is going to be much greater. So you really want to pay attention. And I want to end this with a quote by one of the American presidents, and I'm not going to say who, because once you start talking about who, whether it's Republican, people now automatically brand you as either a Republican or Democrat. Quite frankly, the politics in this country are something else. All right, we are at war with the most dangerous enemy that has ever faced mankind in his long climb from the swamp to the stars. And it's been said, if we lose that war, and really we are in a war, Alzheimer's disease is probably the greatest threat, in addition to the other viruses and all that. But if we lose that war, and in so doing lose this way of freedom of ours, history will record with the greatest astonishment that those who had the most to lose did the least to prevent it from happening. Those who had the most to lose did the least to prevent it from happening. Folks, ladies and gentlemen, thank you for listening. Those who have the most to lose when it comes to Alzheimer's disease are Black people, people of African descent or African origin. And I really implore you to take your brain health seriously. And the first place you want to start by doing that is to take your arteries, the health of your arteries seriously. So thank you for listening. Dr. I'll hand it back to you.
Thank you so much. Oh my gosh, that was loaded. Kindly put the slides down so that I'll be able to better see hands raised and stuff like that. So, Auntie Tawama, you have your hand raised. Now, if you please put the slides down. We can't hear you.
Yeah, I'm trying to, okay.
Not
everyone.
Not human. Dr. Ajibade was talking. I was trying to have him put the slide down.
Okay, I'm trying to stop it now. Hang on a minute. All right, so
do escape.
Stop sharing. Okay, stop sharing. Okay, bingo. There you go. I see it. Thank you.
Okay. So sorry, ma. Welcome, ma.
That's okay. Good evening, everyone. I'm just wondering, this is wonderful. This is a nice topic and it's very voluminous. Well, I learned a lot of things from it. It was talking about dementia. What's the difference between dementia and when we say somebody is really crazy? Mental, that they are cuckoo, something is hitting their brain because they may be acting normal, but there's something in their brain that is out of wacko. Is it all this vitamin B, vitamin C, vitamin D that they are deficient of, or why are they crazy? That is one part. The second part, you said we shouldn't be using calcium. So if you're not using calcium, what about our bones? What do we do? Well, there are some food that we eat that has calcium. How do you get the calcium out of the food you eat? You said if you are going to do anything, make sure that you don't take calcium. Most of the supplements, they come together and there's no way you can actually extract calcium out of the supplement. So what do we do?
Dr. Ajibade,
Yes, ma'am. Okay.
do you want to answer that, or you want me to?
Yeah, go ahead, doctor.
Oh. Jeez, you chickened out.
I may be able to chip in on that.
Go ahead, please.
Okay, so good evening, everybody.
Where is your camera?
I'm in bed.
Go ahead.
Okay, well, dementia and psychiatric issues, they're two separate things. And most of the time when I talk to patients and administering cognitive assessment on them, especially we as Black people, this is one of that's why I really wanted to answer the question. This is one of the things I get, like, oh, I'm not crazy. So checking your cognitive ability to know what is really going on with you is not that you have a mental illness. So they're two separate things. Being forgetful, and if I might want to ask they probe a little about what you were trying to say, maybe somebody being combative or aggressive at an older person. Is that what you're talking about when they're crazy, right?
No. Where we come from, when people started going like cuckoo, they are crazy, they don't know what they are doing. It's not that forgetfulness, but really crazy psych. They are psycho.
Yeah. Okay, psych. Being cuckoo, crazy, well, having psychological issues or psychiatric issue is maybe you're talking more in the aspects of maybe schizophrenia, bipolar, and all those. Those are two different things. Losing cognitive ability, like forgetting stuff, you might have some people that have both. Maybe they have some psych issues going on with them and they're losing their memory too. Dr. Ajibade, I think he mentioned something about some people might, because they're forgetting stuff, they might get mad that, oh, they're forgetting. But that's not the psychiatric part of it. So cognitive decline is different from mental psychiatric illness. I don't know if I'm able to put a little light on that, but if you have any other question or somebody else that want to talk on it.
Thank you very much. It helps.
So it is true that when somebody is crazy, as we call it, it is not dementia. Dementia actually has, several components to it, or, even before using the word dementia, forgetfulness, not remembering something, not remembering someone, components. People who have depression may have memory deficits. They're depressed. And part of the symptoms of depression is memory issues. They start forgetting things. You treat the depression and their memory, they regain their memory back. And people with depression, usually they will come to you, they'll say, their mood is sad, they can't get up to do things they love to do, they can't concentrate, their memory is impaired and all of that. People with dementia don't even know that they are forgetting, that they have issues. They don't. It's people around them who usually would notice that they're beginning to forget things. And, Dr. Ajibade did mention about agitation. They get agitated and, they get combative. They may say somebody stole their stuff. They kept it somewhere. They forgot where they put it. And then they'll accuse somebody. And they'll feel strongly that the person, they start exhibiting different kinds of behaviors. Dr. Ajibade has done an excellent job cramping segments that should in God knows how many series into one, so they're different. And I hope, I'm able to, explain that. That's different from psych issues. Calcium supplementation is right on the money. Nephrologists at one time were wearing, they were wearing a badge in the hospitals that no calcium, basically trying to communicate with us, family practitioners, internal medicine doctors, that we should not be prescribing calcium to our patients because it would impact their kidneys negatively. There's a research that came out that suggested that we should not be taking multivitamins. So you are right, Auntie Tawa, when you said you cannot separate this. It's in multivitamins. You should not be taking it. If you are still able to eat, you can eat your own food and all of that, then you should eat the supplements in your food. We shouldn't be taking multivitamins, but we can take specifics like the zinc, vitamin D when you're deficient, vitamin C, B1, thiamine, is magnesium, especially in alcoholics, they usually will need that. So you take what you need if you are deficient. United States is amazing because we're able to test for these things. Most of my patients have vitamin D deficiency, no matter what color they are. And Dr. Ajibade touched on that. So please, no calcium supplementation. Don't take it. It's not good for you. And for he mentioned also about the question of, because we are Black, why don't we get vitamin D from the sun? We have melanin that shields us from the sun. And in essence, shields us from getting adequate vitamin D like we should. People talk and say all the time that Black don't wrinkle. We get to certain ages and we don't have wrinkles. We have beautiful Black skin, but guess what? It's because of the melanin, and but then it shields us. So that's important to know. And we also need to know that we actually advocate that whether you're Black or white, you should put on sunscreen if you're going to be in the sun for an extended period of time, because of sunburns, because of, that skin cancer also. So do I answer the question for you?
Yes, I have one more.
Okay.
On the potassium, you said you said 3,000.
Okay, so on the potassium, thank you for raising that question. I, as an allopath, will not recommend potassium supplementation unless you are deficient. I would like Dr. Ajibade to comment more on that. I would like to check your blood work to see if you lack potassium for whatever reason and you need to replace it, because potassium can become dangerous. You get too much potassium and it can kill you. Mm-hmm. So that's one that I have written down also, that I want to ask the question, because that's like, like vitamin D is fat soluble, and that's why we keep following it to check the level, because toxicity can occur, and we keep checking the level to make sure that, it's okay to still continue to supplement. So Dr. Ajibade, can you comment on that potassium?
Yeah, absolutely. So I agree. I mean, we've been trained in hypokalemia or hyperkalemia can shut your heart down just like that.
That is high potassium for our audience, hyperkalemia.
So hyperkalemia means high potassium can really shut your heart down just like that. So I was very wary about saying this too in public too, but I had to do a deep dive and research it. And I actually listened to other allopaths, conventional medical MDs and all that, cardiologists, who were saying the same thing, that they are seeing that we're not getting enough in our diets to meet our potassium needs. Now, there's a problem with the blood tests, which is the general blood tests that is pointed out. Same thing with magnesium too. Potassium is primarily intracellular, so it's hidden in the cells. the majority of the potassium is hidden in the cell. So even when we do a blood test, unless it's a very special kind of blood test, one may not be able to determine the true status of the person's potassium levels if it's just based on the blood test. I don't know what kind of test you do, Dr. O, but that's the challenge. And so after checking and looking at different places, it came to my conclusion, and that's what I take it for myself now. Probably I should just have said, this is my own, what I do for myself. I try to take larger doses of potassium, and they take it quite a while now. But that's probably something you want to check. I apologize. I probably should have just said, at least myself, you might want to check with your doctor to see how much potassium you need. But what we found out is that people who have trouble controlling their blood pressure with the regular medications, if they add magnesium and potassium and vitamin D3 and vitamin C, we found out that their blood pressure becomes much better controlled with the addition of those things. In fact, when I was in Nigeria, there was this military guy, because I'm a military veteran myself. My mates are now generals. So I tell people, don't mess with me. My mates are major generals. Anyway, so even some of my juniors are now major generals. So I prescribed this. He was on regular medications, two different drugs, three different drugs. And I gave him just the vitamin C, and it's powder now. I always emphasize, you want to put it in you want the powder from, not the tablets, because you don't want to drink everything at once. You want to take it over a period of time. I gave him the powder and I gave him the vitamin D3. That was at 10,000 international units. What is recommended is ridiculous. I mean, I can say that with all confidence. The 600 is ridiculous, quite frankly. And he went back to his doctor, and then they were checking his blood pressure, and they were absolutely shocked. He was still on his medication, obviously, but he was having trouble controlling his blood pressure just on medication alone, because the arteries need magnesium, they need potassium, they don't need calcium as much. They need vitamin C, and they need vitamin D. And once those were provided, the arteries became healthier. And atherosclerosis, there's no way to prove that now, but I'm assuming that to some degree the atherosclerosis and the problems in the arteries are abated a little bit. So it's a question of, again, you would have to confirm with your doctor for the potassium levels.
Thank you.
So what is atherosclerosis? Because that's a big word. You need to explain that, please.
Thank you. So atherosclerosis is hardening. Literal definition is hardening of the arteries. The arteries are meant to be soft and pliable. So when blood is flowing through, they expand so the blood can flow through, and then they can contract. So the blood, if the blood is not moving like it should, it can contract. But what happens over time, and again with age or with illness like diabetes, or even with high blood pressure, is that the inner lining and even the muscular outside layer of the arteries begin to get harder and harder and harder because of maybe deposition, inflammation, clot formation. It's kind of like, if you think about a lead pipe, hundreds of years, I stay downtown Baltimore, so we're dealing with old pipes. After hundreds of years, those things begin, you have all this deposition in the inner lining, maybe it's lead or copper, all these things, they deposit. So the water does not flow as much as before when they were new. It's a similar concept. With time and age, your arteries begin to have this deposition on the inner sides. They're not as soft and pliable as they used to when you were like 15, 16, 25 years of age. So I hope that explains a little bit, Dr. O. I mean, I'm sure you do a better job at this.
Oh, no. You did fantastic. I would still recommend that, before you start taking potassium supplements, that you check your level and see what the level is. And if you are on high blood pressure medication that includes what we call water pill, you probably most likely may need potassium supplementation. You know, Dr. Ajibade mentioned something very important, that please don't take calcium supplement, because there's a reason why we take, you know, things like calcium channel blockers. It's a class of drugs that is used to treat high blood pressure. Some people who have high blood pressure here may be on something like amlodipine, felodipine. You know, those are the most common one recently. There are some older ones. If you are, those are calcium channel blockers, and they bring down your blood pressure. The research that came out that changed the way somebody like me treats shows that Black people, our people, respond best to those calcium channel blockers and or water pills. And so are older people. So it's one of the best blood pressure medications that somebody who is Black should use. And so what am I trying to say? Please don't take calcium supplementation unless your doctor says you should take it because your calcium is low, or because, as somebody posted here, Amazing Toyin posted that, no, that's not the one. Miss Florence posted that with osteopenia or osteoporosis, you know, that's bone disease, where the bone is becoming brittle. What is the advice on calcium? Calcium, we prescribe calcium for that. So please rely on your physician to recommend calcium for you to take it. Don't just buy it over the counter to start taking it. So Dr. Ajagbe, you have your hand raised.
Yes, Dr. Ajibade, thank you so much. Wow, it's always powerful presentation when you're talking about body and brain. Yeah, I have one or two comments. The first thing I wanted to add to what you said about vitamin D and vitamin K. Mesaquinone 7 is what is referred to as vitamin K2. And that is actually available now in combination with D3, vitamin D3. So if you want to supplement and you want the balanced kind, you have to buy vitamin D3 with vitamin K2. And vitamin K2, if you're going to read on the label, should say mesaquinone 7 or MK7. So if you're going to buy the supplement and you're looking for vitamin D with vitamin K, look for the ones that they will write on it, either vitamin D3 plus plus MK7. You say MK7, it means vitamin K2, because some of the products are like that. So they are used because the combination together seems to be more efficacious or more useful to the body than just taking them separately.
Okay.
Now the other question I was going to ask you, Dr. Ajibade, is, well, can we just go to the basics? Define for us or the difference between senility, amnesia, and dementia.
Okay, thank you, Dr. Ajibade, for that question, and thank you for the contribution. I actually have next to me a vitamin K2 and D3 combo with MK7. So yes, you're right on the money. It's a good combination. I take it every day. So senility, amnesia, dementia. Senility is the growing old, they call it old timers disease, as you're growing older, your brain function, like your muscle function, like any other function of the organs in your body, they get older, they're not functioning like they should, as they were maybe like you were say 25 years of age. So that's normal, quote unquote, normal aging. you can still do your normal daily functions. Yeah, it's not affecting your functioning as a human being at home. So that's senility. I mean, you might need help here and there, but basically you're still functional. Hello. Number for amnesia. Amnesia by definition simply means memory loss. And there are different kinds of memory loss. There could be memory that you can't remember the past, which is retrograde amnesia. And then I think there's an amnesia if you're going, any new information, you are not able to hold any new information or new things that you learn. So if you meet somebody in the train station, for instance, and they have a long discussion and you meet them the next day, you have no idea who they are. So that's more of a disease state. And it could be different things from nutrient deficiency to a disease like diabetes, to it could be due to Alzheimer's disease. I have a topic, I have a document called the 16 or 15 A's of Alzheimer's disease, or 15 A's of dementia. So obviously amnesia is number one, which is the most obvious ones, but there are like 15 others that have to do with Alzheimer's disease. Alzheimer's disease is a special kind of dementia. There are many different kinds, about 5 or 6 that are most commonly talked about. Alzheimer's dementia is the most common, by about 70 to 80% of all dementias are due to Alzheimer's disease. And like I said earlier, it's progressive loss of brain function, not just loss of brain function, but loss of the brain is dying. It's failing. It's losing neurons, it's losing synapses, it's losing circuits. And it's the brain itself that is shutting down as a result of a program. It's almost like hibernation. Remember, the bear goes during the winter, it goes and sleeps for months. But the reason why it's able to survive after those months is that it slows down its metabolism, it slows down its breathing, slows down a lot of things, and it shuts down. It's a similar thing when it comes to the brain, but what the brain's on is irreversible. But the bear or the animal it's reversible every year. The brain is actually shutting itself down as a result of the signals from the environment. It's shutting itself down, and it's irreversible medically. Does that help answer your question, sir?
Yeah, I mean, I was asking it because I know most of these words are just thrown around and they seem to be used as though they are synonymous to one another. But since you're talking about this type of topic, I thought it would be appropriate for you to just help the audience decipher between all these terminologies. Because I know definitely, when we see somebody who is aging pretty much like around 80 and above, and they seem to sometimes forget what they're about to do or what they went to a room to get. We say, well, that's senility, you just assume that, well, nothing else is going on other than the fact that they're just old. And then sometimes they talk to themselves and say, because they're not sure whether they're talking to people, but somehow they are mumbling stuff. And sometimes people will label them as old age madness because they are no longer behaving the way they used to behave. Now, because they are old, they might get up and be talking, thinking everybody's listening to them, but nobody's here understanding exactly what they're saying. So I see that as being what most people will refer to as age-related, because they say, well, it's a senile, when they say somebody is becoming senile, they're forgetting simple things that they would normally remember, and so we can put that in that category. So amnesia can be at any age. Amnesia, could be as a result of, trauma, somebody bumped their head. Concussion is one of those things, as you see in, all those people playing contact sports. banging their heads against one another, against the floor, against objects, can eventually lead to memory loss, which will be described as amnesia, which is not the same thing as, dementia. So that's the reason why I was asking if you can decipher, kind of just separate the three so that it cannot be, interchangeably described as being the same. And of course, you've done an excellent job on dementia. So I wouldn't say anything more on the dementia part, but those two, senility and amnesia.
Thank you, sir. Very much appreciate you, sir. I'm trying to get through the questions in the, wait a minute, it seems like I'm missing something. Do you feel Dr. Ajibade needs to expatiate on the differentiation? Is that?
No.
Okay. Do you want to, were you expatiating more?
No, it's okay. You can get to other people's questions.
Thank you. Dr. Izugu, sir, you can ask your question. Kindly unmute.
Sure. Dr. Ajibade, thank you so much for that presentation. That was really beautiful. You really underscored the importance of the end vessels, end organ vessels, the tiny vessels that go to the main organs. Those of us in cardiology know that the major problem is what is happening at those end organs. So each organ have blood vessels that go to them, and by the time the blood vessels get to them, they are very, very tiny. And because they are very, very tiny, so if you measured your blood pressure in your arm and it's 150, you can imagine what pressure that little blood vessel that gets to the organ is feeling. And many a time is the damage to those end organ vessels that create problems with brain, kidney, eye, in many of these end organs. And so your statement in terms of checking your pressure, taking the medicine, all those are very important. Okay. And when it comes to things like calcium scoring, that's very important. And yes, it's not available in Nigeria, but it's available now in some areas in Nigeria. Okay. We have a center where you can do calcium scoring, even at Nsukka now. You can also do, carotid intima thickening and check all that and begin to manage those conditions very early. Now, in terms of electrolyte supplementation, yes, when it comes to things like potassium, yeah, we do encourage to check the level. And also to know that these potassium, magnesium, so all of them, they're involved in certain pumps that are actually functioning at those end vessels at that level. So making their number normal is important for the normal function in those areas. So there are so many things we can do if we can just take preventive measures to reduce the chance of really people getting dementia. Okay, so I really appreciate what you're saying and what we need to do. If you are involved with any doctor where they can do remote monitoring for you, where you can check your pressure and is going to the doctor to help manage you, please take advantage of those things. It's not like you checked it today and it's normal and you say you're not going to check it again. Those are really the best bet you can do. And of course, eating right and exercising. Thank you.
Thank you so much, Dr. Izugu. And I want to use this opportunity to say that Dr. Izugu has state-of-the-art cardiovascular and primary care, actually, clinics in Enugu, and one is just starting in Lagos, right? Or it started in Lagos already.
Yes, April 1st. April 1st. The election pushed things backwards a little bit.
I'll tell you, whatever you get here in the US, even in some settings, you cannot get what you will get in these clinics in Nigeria. And they are monitored, by satellite also, or, virtually from the US. So they get real-time care if the physicians there need assistance or what have you, real-time care. What he's talking about, calcium scoring and all, is now available in Enugu and in Lagos. So, and there's health insurance also provided in these settings for Nigerians. So my recommendation, because I'm doing this when I get home, and you can do it from here, all my family members, extended families, you know how they call you and they say, oh, so person is sick, send 200,000, 500,000, get them insurance.
Right.
Kindly hit me up so I can hook you up with Dr. Izugu.
That's exactly.
Get them health insurance, and it covers all their primary health care, cardiovascular health care, and all of that. Dr. Ajibade, isn't this amazing?
Yes, that's fantastic. Fantastic. Well done, sir.
Thank you. Thank God. Thank God.
Thank you so much again for what you're doing to beautify our country. You know, those are one of our we're talking about brain drains. These are the brains that are now connecting. Or that's what I want to say, because it's here, it's there, connecting. And that's what all of us need to emulate and do. So thank you.
We thank God. Thank you.
Doing medical missions. There are many other places to do that. So, Dr. Jagwe, did you have your hand raised again? Can you invite me, please, to allow Ms. Titilayo Akinshola to go first, and then you? Thank you. Since you have had an opportunity before. So.
Okay, good evening, everybody. I'm Titilayo Akinshola. This is my first time actually on this forum. Thank you so much for inviting me.
Welcome.
I am a nurse practitioner, dual certified in family practice and mental health, but I do more of mental health. So we get a lot of referrals for clients that have dementia, and most of them are elderly. Sometimes they're sent from primary care providers, and I just wonder what they want us to do with them. Because a lot of medications that we would prescribe, for mood stability and things like that, they have this black box warning, that to be careful prescribing for adults. Most of the time I'll refer them to neurologists. I just wanted to know, like in primary setting, how do you address, treat dementia, mostly for the elderly? Like what would you recommend to help either slow down the progression or to treat the symptoms that they present with?
Let me apologize to you first on behalf of my colleagues, the family practitioners, and the internists, because we should not be referring people with dementia to you that as somebody in psych. What you do, like Auntie Tower's question was to differentiate between mental health issues and dementia, is what you are alluding to. Mental health issues are totally different from dementia. So neurologists are the ones, you're right, that should handle that. And those are the ones we should be sending them to, not to you. If somebody has depression, bipolar disorder, schizophrenia, and anxiety, stuff like that, and if primary care physician or internist feel that they don't want to deal with it or can't handle it, then they need to refer them to you, but not dementia. And please, when you see that, pardon us and just move them quickly to neurologists. Don't even bother about trying to see how to treat. It won't be appropriate, because things need to be done. They need to be imaged, MRI and stuff like that. There are steps that needs to be taken to make decisions on what to do. So, sorry.
Thank you very much.
You're welcome. Excellent question. Thank you. Please leave me your contact information in the chat box. If you private chat me, that'll be great.
Will do, ma. Thank you.
You're welcome. Dr. Ajagwesa, you can ask your question. Kindly.
Yeah, I just wanted to add a little bit to what Dr. Ajibade has said. Dr. Ajibade, I'm not sure if you mentioned anything about coconut oil.
It didn't.
The efficacy of coconut oil in dementia, either in prevention or kind of slowing it down. So that's one thing. The other thing I wanted to add is about omega-3 fatty acid, inclusion in the diet And flaxseed is one of those very rich sources of omega-3 fatty acid, as well as salmon and anchovies, and even the fish that they call Titus, which is mackerel. They are very rich and high in omega-3, and they are very important as part of the vascular health, nutrients.
Can you do me a favor, Dr. Ajibade, please? Can you please help list that in the chat box so that I can share that later if it's needed, or people can, have easy access to it. And thank you so much for sharing that wealth of knowledge. Thank you.
Yeah, those are great contributions, Dr. Ajibade. Obviously those are super important, but and forgive me, folks, because I always think in terms of what I call the lowest common denominator. What are the most absolute, you can't divide any further than that. You can't go any lower than that. So that's why what I recommended were the absolute, in my opinion, minimum that people should be taking. And then, of course, the problem with fish oils, you can't eat salmon all the time. That's super expensive. And then anchovy and all those.
Especially because they have to be wild caught.
They have to be wild caught.
Yeah. Not farm raised.
Most of those farm raised, most things you see in the grocery store are laden with not just toxins, but antibiotics and pesticides and chemicals and all those other good stuff that are in there. So it's always with a grain of salt. But even the supplements themselves, over 95% of them are not being processed correctly because it's expensive to process omega-3 fish oils in such a way that it maintains the quality of the DHA and the DEA, which are DHA and EPA. No, it's like DHA. It's EPA, right? That's the other. Anyway, there are two main chemicals, two main kinds of omega-3s in fish oils that are super important for the brain. And the process of getting them out of the fish and making them available is very expensive, very intensive. Most people cut corners. Most manufacturers cut corners. There are only very few. I can name them on one hand that actually do the job. And the way we found out about it was that we started with our foundation. We found a company that we just went to National Hospital. They donated to us. And we would just go to the physical therapy department and just give it to the mothers who had kids with severe brain damage from cerebral palsy. And then we'll just let them know, if you want more, come to our foundation. Almost all of them came back to our foundation. And we kept on giving them for as long as we were receiving them from the US. We kept on giving them out. And the results were absolutely remarkable. Now, we tried other fish oil supplements. We didn't get the same results. We got nothing. So there are very, very few. So it's very, very important that you get the right kind of fish oil supplements. And the dose is a lot higher than what is recommended. Some people recommend like 4,000 milligrams a day. So it's very important. So anyway, I agree with Dr. Ajibade. It's just that some of these things are not as easily gotten, especially in third world countries. But in the US, if you can get it, you can afford it, if you can find the right kinds, then absolutely, you got to take all those things that Dr. Ajibade mentioned.
So, yes. Dr. Ajibade, one thing that I did not mention is that you can actually be consulted because you know this company. And I have ordered stuff from there before from you that are just, authentic. So if you put your contact information in the chat box so that people who want to contact you can do that, that'd be great to consult. Okay.
Yeah, I was going to say, Dr. Ajibade, that the plant source or plant sources for omega-3 are more easily accessible. Like flaxseed is easily accessible, as well as chia seed is easily accessible. So, I mean, if you don't have to look for anything else if all you can afford is the plant-based sources of omega-3. They're doing both.
Can you please help us put it in the chat box as I please for people who are able?
It's already there. So.
He has it there.
Oh, thank you. I didn't look. Thank you so much. Madam VP, Madam CEO, Madam Lara Okunubi.
Yami.
Welcome.
Omoloku. Abajalon.
Thank you, Ma.
We're happy to see you again, smiling.
Thank you.
Great presentation. Dr. Ajagbe, is coconut oil the same thing as adiagbon? I don't know. Then Dr. Ajibade, you said whatever fish oil supplement, you observe remarkable result with people that have cerebral palsy. Mm-hmm. Did I hear you correctly? Okay.
You did.
Well, I'm going to need that information because that's the demographics that I work with. And if there be anything organic that can, do they have to, anyway, please leave your number so I can.
I will connect you. Don't worry, man.
Okay. All right. Thank you.
I'll connect you.
Yes, adiagbon is the same thing as coconut oil.
Okay, fantastic.
So do they drink it or do they just put it on the hair?
You use it to cook. You use it to cook.
Oh.
And some people add it to their beverages, so you can do whatever you like with the coconut oil as long as you ingest it.
Where did you get coconut oil from?
Just a minute, Dr. Ajagbe, do you know that this was traditionally used to plait hair in Nigeria? That's what I'm asking.
Yes.
So that doesn't count, using it to plait because it grows the hair. That doesn't count.
Let me tell you this: the oil is one of the best best gifts that God has given to mankind. The coconut oil, but because we see it in large quantity and is common, just like any other thing, anything that is common is not appreciated. Is what we don't have that we look for money to go and get it. Just like any other herbs that we have in Africa, we have so many that will benefit us, but we don't use them the way we should. So coconut oil, when it comes to America, they then refine it for you, and then it becomes, they make MCT oil from it. MCT oil too is still good, but now because of competition of manufacturers, they have to defend their stuff. So sometimes you hear all kinds of negative things about, MCT oil. But MCT oil is superb. I still use MCT oil. But you just have to do everything to moderation. Everybody, when they knew about MCT oil made from coconut oil, people were just drinking it, doing all kinds of stuff. But if you do it to moderation, it has its effects on blood vessel elasticity, for instance, is very, very important to that. And actually, there are data to support the reversal of atherosclerosis in long term. So for the brain, I think, you can always search for it. It's very good for the dementia.
Okay. Coconut oil, yes, but please remember, Medical Mondays family, that our lifestyle medicine body, Dr. Ashby, gave us, research to say that MCT oil is not the oil to use. So if you're going to use coconut oil, use coconut oil. This was a while back. And if you go back to that series with Dr. Ashby, you will be able to see, to go over that episode where she talked about MCT oil. So, and you can access that via YouTube or Facebook, Medical Mondays with Dr. O. So, Dr. Buka.
Hello.
On mute, please. Thank you.
Yes. In Guyana, just an information, when the baby was born in my time, coconut oil was made fresh and it was used to wipe the, you shine the babies down and so on. And I do have some coconut oil that's fresh. I bring it from Guyana. I used to take a teaspoon of it, but next time I go to Guyana, I'll get you some coconut oil.
Yes.
Yes, so I do have some here with me. Now, the other thing, just passing, somebody just dropped me some merengue powder. What is merengue used for, just as a side thing? I remember it was discussed here, but I can't remember.
It's a lot. Doctor, I'm going to refer to Dr. Jagbe for that. Dr. Jagbe Moringa, please.
Yeah.
Well, moringa is one of the best leaves that we can have access to. Moringa has 17 times the amount of vitamin C that is easily accessible to the body or easily available to the body compared to the citrus sources. Okay, that's number one. Number two, if anybody has constipation, if you want to detox, and you have moringa powder as first thing in the morning, you will go a lot during that day. Very, very important. So the same thing with all the minerals and other vitamins, very high in moringa. So if you have moringa, you don't even have to go and look for ester C, which is the expensive vitamin C that everybody is running after. If you have moringa, it has every other thing, even all the minerals that we're talking about, all balanced in the same product. So as a disclaimer, I do not have any financial interest in moringa production. So I'm not selling anything, but it's for my, personal benefits. I've experienced it, and I know it's documented very much in literature. So
is it for diabetes or hypertension or something?
It's for everything.
Oh, okay. So a little bit of water in the powder in the water, and you drink it.
You can do anything you want. You can make it into a tea, or you can add it to the powder. You can add it to your cereal.
Okay.
Are you having a bowl of cereal? Or you can put it in smoothie, or you can put it in yogurt. You can put it in anything you want.
Okay.
But just do it to moderation, because it will take your blood sugar down. The same thing, it will work on your blood, cholesterol. It will work on your blood pressure. Everything is in that plant.
Okay.
Don't try to take too much of it. We cook the leaves here.
Moderation.
And we were up all night on the commode. So
yeah,
it's called the tree is called the tree of life.
Of life, exactly. That's what I wanted to say. It's called tree of life, exactly.
Yes.
Store-bought moringa the same as all this, or where can you get an authentic one?
You can get it from Burlington store if you go to their exotic, product site. You can find authentic moringa there, or you can bring it from Nigeria or Africa.
Burlington Factory?
Burlington Coat Factory, yes. Mm-hmm.
Wow.
So, Rose MC, sorry, asked, with the supplement of immune, will that benefit? I'm not sure what that is. When you were presenting, Dr. Ajibade, and talking about, I think I saw when that question came up, you were talking about the brain at that time, was when that question was asked. Rose MC, can you raise your hand and ask your question, please? Because it's not clear. So while you're doing that, I'm going to go to the next thing. Dr. Ephraim wrote the serenity prayer that you were asking for, Dr. Ajibade. Here's the quote: God grant me the serenity to accept the things. Oh, wow. Please pardon me. It says, God grant me the serenity to accept the things I cannot change, courage to change the things that I can, and the wisdom to know the difference. Then it says, thanks for sharing, and that these are important information we need to be strong, to stay strong. With the dirty dozen, any reason why the first and the ninth items of the eyes are in red ink? And the number 1 is illness, and number 9 is infection. Dr. Ajibade.
Yes, so there are 12 of them. I obviously couldn't discuss them all, so it was just a personal reminder to me to just highlight those two, and let you know that I'm just highlighting those 2 out of the 12. So that was why I highlighted it.
Thank you. So thank you so much. And thank you, Dr. Ephraim, for that question. I wrote some questions up there that I want to ask the whole audience, because I want to take a poll, and this is very important. We are seeing a lot of memory lapses, is what I want to call it these days. I get calls from friends, from patients, that they're forgetting things, forgetting people's names, forgetting even their siblings' names, forgetting chores or conversations. They've had a conversation and they just don't remember it happened. So the questions I asked, and I'll keep reposting them, and I'm going to send them to you by email, please, is that you should answer if you've had COVID, and, yes or no, if you got immunized with COVID vaccine, and if yes, which one did you get? And if you are having those memory lapses. I'm going to repost the questions, so kindly answer them. You can private chat me. We're trying to get a poll because, believe me, I think we need to get this to people that matters so they can start looking at this. And we're going to have another session to look exactly at that, because I think this subject is so huge. What has been done tonight is an introduction. So the core of then, what do you do to prevent? That's what Medical Mondays is about. How do I prevent this? How do we change the status of those who are already experiencing memory lapses? And they're not depressed. Something's going on. So when you see those 2 reds, illness and infection, remember the infections we're dealing with right now. COVID is a big part of it. And we just want to see if there's a correlation and what needs to be done. Dr. Lola, kindly unmute yourself to ask your question.
You're driving. Hello.
Hello.
Hi. I want to know, find out if anybody know anything about ginseng. It's being used for increasing memory gain. Do anybody know anything about ginseng?
Is it ginseng?
Ginseng root. Yeah, it comes in a capsule form. Ginseng. Also comes in a powder. It comes in a tea.
I have seen it. I don't know much about it. I've not seen any research on it.
May I say something then?
Go ahead.
Can you show your camera? Yes.
I'm indisposed.
Oh, sorry. Sorry.
All right, no worries. Ginseng is for stamina. Ginseng is for strength. But what works for memory is ginkgo biloba, not ginseng. Ginseng doesn't really work on the brain. It may have side, thing if it opens the blood vessels, but ginkgo is actually the one that works on memory. So you can check it again. I can show you.
Actually, it's both, Doc. Sorry to contradict you, but it's both. Ginseng definitely helps with blood flow, but they've done studies with ginseng too to show that it improves in some cases, but it's not been. The claim is that it's not been conclusive. In some cases, they've seen significant improvements. In other cases, they haven't seen anything. So they've not been able to come out and say ginseng is definitely helpful for memory. But some studies have shown that it does help. The problem now is we just don't know how much, because I mean, I take ginseng every day in my coffee. I take ginseng every day. It's still something.
I do too. Yeah.
In my coffee. But
Dr. Ajibade, hold it, sir, please, sir. Go ahead. 1 minute, sir. Conclude, Dr. Ajibade.
Okay, I'm sure. I'm not sure if what I take in my coffee is enough to prevent memory loss. But the problem is that they've not come up with any scientific formats to say this is how much you should take and this is how much you should not take, or how much is lacking. But they've definitely done tests and they've seen that it helps, as well as ginkgo as well. And I have both ginkgo and ginseng in this coffee that I take every single day.
Okay.
But I wouldn't.
I want to finalize. Also, moringa comes in tea. It comes in capsule form, and we do sell them in my parties also. They come from Pakistan. Thank you.
Thank you. Dr. Ajibade?
Well, yeah, I mean, the effect of ginseng is primarily on blood vessels. So, yes, as Dr. Izugu mentioned at the end, arteries to the organs are where the action really is. So if ginseng helps in those kind of areas, yes, of course, particularly in the brain, then it definitely is. It has an indirect and direct impact on memory. So, but ginkgo biloba with vinpocetine combination seems to be the primary combinations for memory, particularly for those who have attention deficits. You know, they can't concentrate if they take ginkgo biloba with vinpocetine together. You know, it seems to be a very great help.
Thank you. Thank you so much for that input. So before I switch, I'm going to go back to the coconut oil. There's a question here that, can we just buy the coconut and press it for the oil? And another question is, how does virgin olive oil compare with coconut oil?
Well, are you asking me or Dr. Ajibade?
Ajibade.
Okay. I don't know how they prepare the coconut oil, so I probably would not be able to advise on that. But just, I'm glad Dr. Ajibade brought it up, because there's a book by a medical doctor whose husband had moderate to severe Alzheimer's disease. She started studying about coconut oil and MCT oil. Apparently, they're not exactly the same thing. She started giving half and half of the coconut oil as well as the MCT oil, and she documented in a significant improvement in her husband's. So her name is Mary Newport. Newport is Newport, where she wrote a book about it, and so you can find that on Amazon, I'm sure. What coconut oil does that olive oil does not do is that coconut oil helps to provide what are known as ketone bodies. Probably you started hearing about the ketone diet, or the ketone diet they call it. Ketogenic, that's right. The ketogenic diet probably is the new thing now. Everybody's talking about it.
No, we do not recommend it at all. It increases cholesterol to dangerous levels. I mean, like the LDL goes to over 600. I've seen it in a patient. It's crazy. And when I told her to stop the diet, the patient stopped the diet, cholesterol went back down, but it took months. I mean, I had to wait 3 months to recheck it. It took at least 6-9 months, but it went back down. So please, no fat diets. That's why we have Medical Mondays. So know how to eat right and stay away from the fat diets.
I wasn't recommending it. I was just referring to it because that's what they're trying to do. They're trying to increase ketones. Ketones, now the brain's primary food source is glucose. But they found out that it can take ketones as an alternative. And in fact, it uses ketones even more efficiently than glucose. So what the MCT oils do, and what the coconut oils do, is that they provide the brain with this alternate fuel to help nourish the brain cells. What we know is that one of the key things with dementia, especially Alzheimer's dementia, is that the brain cells are not using glucose like they should. It's a condition called hypometabolism. They've found this out over and over again, that the brain cells, for whatever reason, are not able to intake glucose and metabolize it like they should. However, they can take ketones more easily if the ketones are available. Most of our food diets don't provide ketones, but the coconut oil and MCT oils is a hackable system where you can provide the ketones quickly to the brain, and that's probably why it provides the nourishment that it does. I don't think virgin olive oil does that. I mean, it's probably one of the healthiest kinds of oils. It has the omega-6s in it, and omega-3s in it, and it's healthy and all that. But in terms of providing ketone bodies or the MCT oils that the brain needs, I can't speak to that with much authority.
Okay, and another thing is the virgin olive oil, please don't heat it. Don't use it to cook. You can put it on your salads or things that are cold. It's an excellent oil, but not for cooking. It's not stable for cooking. It becomes toxic. Coconut
Dr.
oil.
Which oil is stable for cooking then? I mean,
coconut oil is stable. Grapeseed oil is stable.
Avocado oil
is stable.
Avocado oil is still the best in terms of the flash points. So if you must use it to fry, avocado oil is the best to use to fry.
I see.
So avocado oil, grapeseed oil, coconut oil.
Oil.
Can one buy the coconut and press it for the oil just in quick 2 seconds?
No, you can't.
Okay.
I know in Guyana what we do, we grate the coconut, and if there's some water, you pour off the water and pour off the water, and you put the coconut in a pan, and you could get the oil from it in a hot pan on the fire. Mm-hmm.
When you put it in a hot pan on the fire, do you have to add anything to it?
No, you could turn on.
A friend of mine from Jamaica invited me, and she did everything in my presence. It's too much wala for me. So she
it's not oil. That bad. We used to grate it by hand. Now you have
me a whole bottle. But she did all the job. It's like you have to grate all the coconut and pour something in a pan, and it's like frying.
And then like it fries down. Yes. Mm-hmm.
So you just put the coconut in the pan without anything in it and heat it, and it fries down.
Exactly.
To bring out the food.
After you grate it.
Not bad.
You have to grate it though. Not
all coconut. You have to grate it.
You have to grate it.
Yes.
Okay.
Like you put it in the blender or whatever with the water. You pour off the water and you you get rid of the water and you put the coconut in the pan, and it will slowly get the oil. Okay. And it's very nice, the fresh oil.
When you do that, you're making shuku. They're making snack.
Yes, and then we eat what is left.
Out of it.
We do that. As kids, we used to run and pick it up from the pan and run out and eat it. Yes.
Nice. Okay. Good. So, Madam CEO, go ahead.
Yes, ma'am. I have a question. Dr. Ajibade, growing up, most of us took this 7 Seas fish oil almost every Sunday. Is that oil still relevant to all of this fish oil that we're talking about now? Do you think it's still? Yeah.
The 7 Seas is cod liver oil.
Yes.
It's from the fish called cod, and it's expressed from its liver. So getting the oil from the fish liver without preservative will be a big chore, will be very difficult. So when you do that, you're getting all the preservatives that make the oil not to become rancid over time for you to be able to enjoy it long term. So yeah, the 7Cs, I don't think, I'm not sure that company still exists. If it does, yeah, if they're still using the same technique, yes.
Okay. No, they still
you can get the capsules in London or in Canada, but you don't get them here anymore.
No, the real oil, we get the real oil in California, the same brand, unless it's bootleg. Yeah.
Yeah, so if you do, then that's the same thing. Yeah, absolutely. And it's only just for the vitamin D aspect of it.
What about palm oil?
Eesh, that's a big one. Palm oil, Dr. Ajibade.
Yeah, so palm oil, I mean, that too has been a question I've had for a while. It definitely has its health benefits, but I mean, we fry our palm oil a lot, and gosh, I don't think it's. I mean, I've been looking. I mean, I honestly have been trying to figure out what is bad about palm oil, because I know there's something somewhere. If we search deep enough, we'll find out what's bad about palm oil. But honestly, I haven't been able to speak with much evidence on it. Dr. O, what's your thought?
Well, palm oil is it's polysaturated. It has polysaturated fat. In our line of medicine, we feel that it can increase cholesterol, and because it's polysaturated. Naturopaths, on the other hand, if Papa Mike was on, he would say, oh, palm oil is the best thing to use. And my take on it, I don't want us to belabor that, is that research needs to be done on it and to know the true benefits or hazards of palm oil. I don't think we have enough research on it yet.
Doctor,
that being said,
let's just say moderation is the key.
Okay. Moderation is the key. Yes.
Yeah.
There are certain things we should not touch also. So I'm moving away from this. Moderation is the key.
No. I'm talking in terms of the palm oil is what I'm saying. Yeah. And I'm trying to show and tell my shuku.
I knew you were trying to show something. I know you too well.
Auntie Tawa got it.
I have everything.
I was going to ask you what that was.
Nice. So I'm trying to make you guys want it.
Okay, so please send some my way. You live just down the road. I want some.
Okay.
I'm going to get Dr. Famuyiwa, please, on the platform. Dr. Famuyiwa, I saw your comment that you said you like to comment on calcium removal from GYN regimens. Kindly comment on that. That issue of calcium is very important. We had lots of questions on it that needs to be answered. Dr. Famuyiwa. Is she still on? Okay, I'm going to move on. If she's on, Dr. Famuyiwa, if you're on, let me know when you're ready to give us that caveat. I think.
No, she's not.
Okay. Oh, thank you, sir. I'll get her back. What is the maximum international units for daily vitamin D? Dr. Ajibade. Dr. Ajibade, you're the presenter, please. Don't feel this forum is for someone else. Kindly answer our questions.
Okay, doctor. I'm deferring to my orgas at the top over there.
No. This is yours. Nobody's taking that from you. What is the maximum international units for daily vitamin D?
Okay. Let me answer from the Mayo Clinic on their websites. They took it down, I guess, during the COVID-19, they took it down because there was a lot of, I guess, abuse and misinformation and all that. But what the Mayo Clinic said was that at 60,000 a day, 60,000 international a day for months, I guess there will be 3-4 months. That's when you get toxic levels. So that was the dose. And I guess Mayo Clinic is as credible as anyone else out there. That was what they said. They've taken it down now. There are others who recommend 50,000. I was reading a book for cardiac disease. I don't recommend that. So the question was the maximum, right?
Yeah, a day.
So,
maximum daily intake, not the 50,000 international units we recommend is once weekly or once monthly. So he's asking the international units daily.
Right. If they're saying maximum, it's clear, my understanding is that is not recommended. So I'm answering based on what he's asking, or he or she is asking for, the maximum. Is that different from, whether that's different from what is recommended is another question entirely. But so I've given the Mayo Clinic answer saying that 60,000 is what they say is the upper limit of maximum. The recommended dose obviously is 600 to 800 international units. My personal opinion is that is terribly low if you are Black, because by definition, if you are Black, you are not getting enough vitamin D from the sun. You have to spend 6 to 10 times the amount of time a white person, especially a pale white person, spends in the sun to get the same amount of vitamin D. And as we've talked about, that is extremely important. Vitamin D is extremely important for brain health, but also for cardiovascular health. My recommendation is 5 to 10,000. Now, there are doctors who are treating dementia, and they're saying, these are doctors like Dr. Dale Bredesen. He's a very good person that I would recommend everybody study about. He's one of the top dementia doctors in the country. And he's saying that his aim is for people to get about 100 nanograms per DL. That's the blood levels. And this is not international units now, these are the blood levels. We normally talk about 30, that 30 is deficient. We talk about 40 to 60 being the sweet spots. But now, the new information that they're finding out, especially those who are in the field of dementia, like I mentioned, Dale Bredesen, check him out. He's saying about 100. There's also another doctor by the name of Dr. Gundry, who is a cardiothoracic surgeon. He's retired now, and so he's into the whole lifestyle medicine and health and all that. He also is saying that he runs a clinic in Palm Springs, California, which, as many of you know, is very hot. There's a lot of sun. He says even there, he finds his patients are very low in vitamin D. So his aim, he aims for about 100 to 150. I mean, those seems like dangerously toxic levels. Yeah. But I guess he also adds vitamin K2. The main problem with vitamin D, let me tell you now, is that vitamin D raises your blood calcium. So the side effects that people get from vitamin D have to do with high levels of calcium in their blood. So they may have nausea, they may have headaches, they may have with sickness and all that. So certainly that will not kill you. So I was taking vitamin D a lot, especially during COVID-19, because I can deal with the headache. COVID-19 can kill you. Headache, COVID-19, headache, COVID-19. I'll go with the headache any day of the week. But if you are concerned about being careful, I would say 5,000 during the summer, and be sure you're going out. Nothing less than 10,000 during the winter. Nothing less than 10,000 during the winter. And if you want to be careful, you take a vitamin D/K2 supplement, because the K2 drives the calcium from the blood into the bones. That's your safeguard. But I would rather err on the side of excess than, like I said, I mean, I know people, when I came from Nigeria, I came in 2020. This was in the middle of all the craziness going on. And I went for meeting after meeting. I traveled around the country, and I was in meetings where they were packed. And I mean, I don't know what the other people are doing, but every time I would left the meeting, this was before vaccines came or anything like that. So every time I left, when there was a lunch break, I'd run to my room and just start stopping myself with vitamin D. I'll stop myself with zinc and all that. I just kept on popping the pills like they were going out of style. Did they help? I don't know, but I'm alive today. So
no, thank you
and I
so
never had
much.
any side effects from it. Yeah.
I wanted to comment on the blood levels. The blood levels, when we check vitamin D levels, it's the normal range, reference range is 30 to 100. So that's where the 100 came from. So
Okay.
for my patients, I usually, depending on the level I, diagnose them with, if it's in the teens, say anywhere in the teens or less than the teens, I've diagnosed from 6 is the lowest I've seen, to 19, 20, I would put them on 5,000 international units a day. I found out that the 50,000 international units a week didn't do much for most of my patients, including me. I prefer the daily dosing. So 5,000, and they usually bulk up, but it takes a longer time than you would appreciate to get there. And the reason I started doing that is because I've had actually a few patients who have had over 100 in their blood levels at 5,000 a day. Wow. If I diagnose them in the low 30s, if a patient comes in and their vitamin D is 31, 32, low 30s, it's still in the normal range, I consider it vitamin D deficiency. And I'll put them on 2,000 international units. I've never prescribed 1,000. So that's my practice, because I want to err on the cautious side, especially for patients who are not adherent, to come back for blood check. Somebody asked how often we have these sessions. Is every week, every Monday at 7 p.m. Eastern Standard Time. Every Monday. Unless there's a reason, then we'll let you know before the meeting. And we email you. Talking of forgetfulness, do you know that I did not send an email today? I remembered after we started talking about forgetting. That was very strange. And this will be the third time. There were 2 weeks back to back that I did not send out email. And then today, somebody needs to be my blind spot. And Dr.
Because you're stressed.
A lot went on over the weekend, yeah. So Dr. Augustine Nwebweze talked about hyperkalemic patient. That's a patient who has high potassium with problem with their kidneys. Their filtration rate was low, 33 to 35. Filtration rate should be 60 and above. So this person has kidney problem. They are not on dialysis yet, but they seem to be, maybe heading there. What's the advice on handling such patient? I would defer to the nephrologist.
Recording in progress.
I would defer to the nephrologist for this. The reason I would defer to the nephrologist for this is because we don't know what the other medical history that this particular patient is dealing with. And on this platform, we don't establish doctor-patient relationship. We share knowledge and we will refer and defer, but we don't establish care. So there's a lot more that needs to be known about that patient to know how to advise. So Dr. Akinshola said, excellent presentation, Dr. Ajibade. Can you tell us what types of foods aside from banana is rich in potassium?
Well, the vegetables have potassium. Yes, you're right. Banana is rich in potassium, but the people are now saying that banana, you don't want to take too many. You don't want to take especially the ripe bananas because of the high sugar content as well. That's in the banana as well as the potassium. And since we as Africans tend to have higher levels of insulin resistance, that may be something you want to watch out for. Because, I mean, there's a lot that we could have talked about with regards to sugar and starchy foods and all those things. But I guess that'll be a different day. But vegetables have potassium. Just as to how much that's available in that sense is the question. I mean, you got to remember that many of the vegetables that are done with the modern day agriculture are stripped of their nutrients, whether magnesium, zinc, and potassium, and all those things. So even though traditionally maybe spinach has potassium, if it's grown in the commercial agricultural way, there's a great likelihood that you're not getting the same amount of potassium that you are getting from it, if let's say 50 years ago. Plus the fact that things like stress and other unhealthy habits too tend to strip and drain your body of these vital nutrients, especially processed foods. They drain your body of potassium, magnesium, and zinc. So that's why I'm more of a proponent for supplementation, in addition to healthy and sensible eating.
So my sister Grace says, what's the distinction between simple supplementation with calcium and actual need for calcium pills to prevent osteoporosis?
If your concern is preventing osteoporosis, as opposed to you have osteoporosis and osteopenia, that's a different thing. If your concern is preventing osteoporosis, you do not need calcium. And I brought this book out. This is a book by a brilliant doctor, Dr. Gregory Hall, Patient-Centered Critical Care for African Americans. I think all doctors, all Black doctors should read this. I found him, the way I found him was that I found out about potassium deficiency in Black Americans. So I said, let me go online and see if somebody has talked about it. And that's how I found him. Eventually, I interviewed him. We did 2 shows together for our Nigerian program, which is, if I may brag about myself a little bit. So we are the #1 health show in Africa, according to polls. We got the award. Did I tell you about that, Dr. O? Did I tell you about that? That we won the award?
You forgot.
Oh my goodness.
And I was praying for that.
I'm sorry. I forgot to tell you. Yeah, we got the award there. We got a congratulations.
Congratulations.
Thank you from the Minister of Health and also from the Director General of the National Broadcasting Corporation. So got that. Anyway, the point is this. Enough about me. He talked about potassium and he talked about calcium. They have found out that African Americans who take calcium supplements are more likely. There's a greater risk, or I think it was specifically prostate cancer. Prostate cancer, if you take potassium supplements. I've read from studied other people who say it increases your risk of cardiovascular events. Taking calcium supplement increases your risk of cardiovascular events. You don't need to take it, especially if you're African American. The main things you need for your bones, you need a vitamin D3, you need magnesium, phosphorus, you get that from food, you need vitamin C. So those 3, vitamin K2, vitamin D3, magnesium, those are the most important things. Now with ladies, the problem with ladies too, especially post-menopausal ladies, is that your estrogen and your testosterone levels are dropping, in some cases precipitously. Estrogen and potassium are both very important for bone health. So once your estrogen levels drop, your testosterone, I mean, obviously you don't have much testosterone in the first place, but once the estrogen levels drop, you're more likely to have osteoporosis. So what we do in our foundation, and I work in Nigeria, which has been sanctioned by the federal government, is that we get nutraceuticals, which are special kind of supplements that help provide you with the building blocks that your body needs to make estrogen, testosterone, progesterone in the right balance. And that also helps with the bones. But you don't want to be taking calcium. You want to be taking the things that will help drive calcium into the bones and prevent calcium from leaving the bones.
Like vitamin D.
Like vitamin D and vitamin K2.
Yes. So what are your thoughts about taking supplements for memory lapses?
Oh, absolutely. I mean, I'm treating people who are again, through telemedicine in Nigeria, as I'm not licensed here. But so had patients who have had COVID-19, they've had severe memory losses and all that. So there are nutraceuticals and supplements that I absolutely recommend because what they do is that they help provide the brain. It's basically what you want to do is that you want to nourish the brain. You want to give the brain high quality, high nutrients, high dose nutrients that will help the brain recover. In some cases, there are some that have to do with inflammation, neuroinflammation, inflammation of the brain. But there are some that the brain just is tired, it's been infected, it's drained of energy, drained of life, and you're basically wanting to nurture it and nourish it back to health. Ordinary balanced diet is not going to do it. The supplements that we talked about today are not going to do it. You got a heartache, you need greater firepower. So absolutely, I recommend specific supplements for memory issues.
Okay. So how about if you can remember your classmates from 46 years ago and they expect you to still remember their face, but you don't remember them? Is that considered Alzheimer's?
No, absolutely not. Unless there are other things that you're not talking about. Some people remember faces. Some people are better at remembering names. They don't remember faces. That's a normal thing. It gets worse as you grow older. So when you say 47 years reunion, that's quite a long time. If there's nothing else, if it's just that I can't remember this person's face. I mean, ladies changed tremendously. Let's face it, over the years. It's makeup or hairstyle or glasses or whatever it is. Men too, with the beard and the not beard.
Not only ladies.
Dr. Ajibade, I could recognize Dr. Ajibade today now. I was like, where's the white beard and everything? Everything is gone. He's now looking like 20 years younger. So if that's the only thing, then I wouldn't worry about it. But obviously, you know yourself, or this person knows themselves. Usually, when it comes to dementia, there are other things involved, not just memory. There could be sleep problems, there could be confusion, there could be anxiety, there could be paranoia, there could be hallucinations, there could even be problems with balance. There could be problems with speech, there could be problems writing. These are all very subtle things that creep in along with the memory, but all they think about is memory. But there are several other things that are neurological that come, and in some cases psychiatric as well, that creep in as well as the memory loss. Some people may just forget to brush their teeth and not think anything of it. They may not bath for 3 days. The person may be normally a very neat person. And then you come to his house or her house and the place is in disarray and they don't think anything of it. These are all subtle signs that there's more than just the memory loss that comes with aging that you should be aware of, that you should, and so this should be that's why I put the 10 warning signs. Those 10 warning signs of dementia, actually from Alzheimer's Association that I'm associated with. Again, I'm not speaking as a member on this platform, so I'm not speaking as a representative of them today, although I do that as a volunteer. But there are 10 warning signs that they give.
We will talk about that another day because of time. Absolutely. We can't go into those ones today. So what medications are best to slow the progression of dementia?
We're talking about medication. There is nothing.
Yeah.
There is no medication that will slow the progression of dementia. There are, however, medications that help in addressing the symptoms, anxiety, memory loss, and sometimes they give antipsychotics if the patient is becoming aggressive or hallucinating and other things. But they do not address the underlying progression, which is that the brain is shutting down and is dying. There's no drug that can stop that.
Not even Prevagen, as they say on the TV every day.
Well, I don't. I mean, that's a supplement with some good things, but as to my knowledge, it has not been used to address dementia. Now, mind you, I said no drug or medication.
Yeah. Yeah, it's hard. Once it sets in, God help us. So that's why we need to focus on prevention. Yeah. And I think we'll touch on those really quickly before we round up tonight. Some comments are made here that Titus mackerel are very affordable in the Asian fresh market stores and in Nigeria too. And salmon and Titus fish are available at Dr. Ajibade. We have okweku, salmon, and Titus fish in Nigeria, and that flaxseed is affordable too. So these things are affordable, and they're, we can easily get them. Thank you for the presentation. Oh, answer that. How often do we? Oh, thank you. Eniola answered that question. So, is there a cure for Alzheimer's? Can the patient improve? And if they can, how?
Medically speaking, the official answer is no. There is no cure. There's nothing to slow it down. It's the big bad wolf that's going to huff and puff and blow your house down, no matter what you do from a medical perspective, unfortunately. And I'm sorry to make light of it, because it's a very, very, very bad thing. So I take that back. Unfortunately, there's no cure. There's no cure for it.
As of today.
As of today.
Hopefully, things may change. So, while we're talking about this, we still keep going back to things that can prevent. And Lawyer Akinshola, even though she's joking here, it's serious that we've been told to include chia seeds and flax seeds, granulated, in our diet. So she said we can add it to our tea and whatever beverage we like. Costco and Sam's Club sell original coconut oil too, she said. But she wrote granulated flaxseed in bracket. It is important. The granulated is the one that you actually get benefits from, not the seeds. We've learned that here on Medical Mondays. So that's why I said she writes, she's always joking, but always, seriously joking. You've got to take her seriously. So the granulated flaxseed, like, Dr. Jagwe mentioned that. Attorney Richard Williams said, very informative presentation. Thank you, Dr. Ajibade. And Abby, oh, that's my baby, said coconut oils, case used cooking for hair and body too. I think she was commenting on the fact that you use coconut oil for hair, body, and everything. And Hammond from England said, morning, can the details be put? You did already. Jeez, I should have gone through these things. It says, so.
Do you have any on Sarah 25? I do. No? There would be few, yes.
So. Dr. Nwabweze is asking about canola oil. Can you comment on that, please?
Canola oil is a vegetable oil. It's a seed oil. It's one of the things like the groundnut oil and other oils that are high in omega-6s, and they are some people say they should be banned. They're highly inflammatory, especially when they are fried, and they can cause the release of very dangerous chemicals that can damage your blood vessels. So the recommendation is that you stay away from them as much as you possibly can, and that you should go with the extra virgin olive oil and other safer oils. And by the way, please don't take margarine. Margarine is a big no-no. Nobody should take margarine for any reason whatsoever. And I'm just throwing that out there now. But yeah,
those butters.
Ma?
I said those butters, the butters, margarine, butter.
No, butter is much, much, much better than margarine. Margarine is synthetic, it's artificial. I don't know if you've seen there was this YouTube thing that the person, and I tried it myself. The person, this was I think Blue Band. They took a chunk out of it and they put it on the frying pan, and they watched and watched and watched. Do you know that thing did not melt at all?
Chai.
Just watch out. I mean, it is really tasty, right, and all that, but it's
margarine.
It's just a few steps away from plastic. So margarine, no. Butter is healthier. I mean, it has saturated fat and all that. But what you should be afraid of are the hydrogenated oils and the trans fats. Those are the artificial, the created fats from petroleum oil and other petroleum products. So the butter, which is the more natural one, is a lot healthier.
Nice. So Haman said in London, England, they can get 7 C's cod liver oil and capsules. Are those good?
Yeah. Cod liver oil is.
You know the cod liver oil. They used to give us that when we were children.
Yeah. Cod liver oil is really good. Vitamin A, vitamin D. What else does it have again? It's got the omega-3s in it, which are good, and even anything liver, internal organs. Quite frankly, we used to think that they were bad. Anything in liver, anything internal organs, are generally very healthy.
Okay, can I add? Anytime you're in transit in Heathrow, just go to Boots. They sell the cod liver oil capsules, sometimes 3, 4. There's always on sale. I always buy about 6 containers when I'm in transit.
Yeah, and it is just shown here also. Dr. Ajay said we can get it also on Amazon. So, what is the difference between vitamin D and D3? I think this person is asking between vitamin D2 and D3. What's the difference?
So there are three main kinds of vitamin D: 1, 2, and 3. The D3 is by many people's opinion, is the healthiest and the most natural, and the most bioavailable. The body makes better use of D3. D2, ironically enough, is what doctors are allowed to prescribe, and it can come in much larger doses, in fact, I've seen one that's 600,000 international units. So the 50,000, like what Dr. O was talking about, is most likely a D2 if it comes in as a one pill or one injection. I think that's what injections. So the D2s are not as bioavailable. They are more plant-based. You want the animal-based D3. The D3 is animal-based, D2 is plant-based. D2 is not as effective. And D2, some doctors who have studied this is more likely to give you side effects than D3. D3 is natural, less likely to give you the side effects.
Nice. Thank you. So is cabbage good?
Cabbage? Oh, definitely. Especially the fermented cabbage. We're talking about the cabbage leaf and plant, right? Yeah. Mm-hmm. Oh, yeah. The fermented cabbage is the best. Isn't that what they get? I've forgotten what this Japanese name called, but cabbage is good. Yes.
Sauerkraut.
Sauerkraut. Is that what you said?
Kimchi. Kimchi is what you're talking about.
Yes,
Kimchi.
that's what I was trying to remember. Yes, kimchi. Yes, yes. Sauerkraut too. Yeah.
So
Sauerkraut,
it's good.
Absolutely.
Okay.
Anything greens, and not you don't want to cook or fry it within the inch of his life. And we like to cook. In fact, there was one pastor from the state. He was saying that his grandmother told him that the only animals eat raw spinach and vegetables. That human beings should not be eating it. And that's how he was raised. So we've been raised with a lot of very funny beliefs back in Africa. Like the one about if you eat egg, you are going to if you give a child egg at an early age, you'll learn how to steal. I mean, what is it?
Can I ask, what about women's vitamins? They sell it at CVS.
No.
Like one pill. Those are not good.
Dr. Booker, no. There's research that has shown that we shouldn't be doing that. No, don't take those.
Thank you.
The women 1 a day, the men 1 a day, Centrum 1 a day, and all those. No. And you know what? If you look at them, you will see that some of them have 600 international units of vitamin D. Some of them 200 international units. They don't really have what you need. And they have all this junk that are, the fillers that are put in there to make it into. Read it, you'll be surprised. But it is medical research that says that, no, we shouldn't be recommending them anymore. And then I paid attention. I was like, oh, whoa, okay, got it. So don't take those, please.
So what vitamins do I take then? Just the separate ones?
Yes.
There's no multivite per se.
Yes.
No shortcut.
No shortcut. Get one of those pill boxes like I have now.
Oh, I do. I take a lot of pills.
So you just throw them in there. It makes it easy once a week. So Dr. Ajay congratulates you, Dr. Ajibade. And Hammond says, any fruits that can help with memory loss or memory loss? Fruits that can help with memory loss.
I can't think of any. And let me just say again that if we're talking about prevention, yes, you can do these basic things, take your balanced diet and all that, and take your supplements, balanced diet, exercise. Once you cross that threshold to having memory loss, balanced diet, we're talking about the most complicated piece of biomachinery in the known universe. We're talking about the brain. These are extremely complicated things. So the rules change after that. Prevention is one thing, but once you switch over to this, you've got to get high dose, high quality nutrients to feed to the brain in the most direct, most bioavailable way possible. So diet and fruits are not going to do it.
Okay. Does exercise help?
Exercise helps a lot in so many different things, but I mean, again, exercise definitely helps, but all the research has been with prevention. Once you cross that threshold and see there's clearly damage to your brain cells, it's tough. It's tough. You have to do several different things at once, including exercise, including improving the quality of your sleep, including giving your brain the things that it needs to help it recover.
So I just want to put it out there. You mentioned earlier on, a doctor who treated her husband with coconut oil and MCT oil and saw her husband improved. That is, is dementia started reversing or reversed. So there is hope. Then there may be a cure for Alzheimer's dementia. And again, I'll be very careful because we don't know the full details of this man's total medical history. When you don't have the total picture, one has to be careful. But it means that there is hope, that we cannot say there's no cure because we already know this coconut oil and MCT oil works. But I can tell you something. I know somebody who was using MCT oil like crazy. Their cholesterol went wild. We need to watch that because when we're talking about atherosclerosis, we're talking about, it's like fat dumping into arteries and blocking it, right? That's what we're talking about. And we know cholesterol, that's what bad cholesterol does. So anything that would increase cholesterol, we need to be careful. That's why I want us to revisit that MCT oil because our lifestyle medicine physicians say we should not use them. Our naturopathic guru, Dr. Marsha Gillum, said we shouldn't use them, but we should use coconut oil. So I'm curious to, I'd like to talk to this doctor that you talked to because I want to know more about that combo, and so that we can bring it back to Medical Mondays to see what works. So goal is to prevent dementia. Goal is to prevent memory loss, correct? That's our goal. And we know that we have amongst ourselves already people who are having difficulty with remembering things. So is it exposure to infection, COVID, or other infections? Is it an illness that caused this? Is it lack of sleep? Because we already know that our brains cleans itself out in sleep, but it is consistent sleep. It is not haphazard schedule. You have to go to bed at 10, wake up at 6, or go to bed at 11 and wake up at 4 every day. Whatever your schedule is, whatever number of hours is good for you, but it needs to be consistent. And we know that research has shown that when people don't do that, it can increase their, chances of developing memory issues. So we need to be mindful of that and, change our sleep hygiene. When we talk about sleep hygiene, I wanted to mention this. Dr. Ajibade said it in his presentation that some people will put the light on and they put music on, even TV. Some people put TV on all night and the brain is not resting. You need to turn everything off, turn the light off, and there are only 3 things you should do in bed. Because of time, I could have asked for somebody to tell me the 3 things you should do in bed and nothing more, but I'm going to tell you.
Sex.
Sex? Yes. Thank you, sis. What else?
Sleep.
Sleep. Thank you.
I guess pray.
Pray. Whoa. Wow. We have an amazing team of Medical Mondays. Our family, Medical Mondays family is phenomenal. Those are the 3 things we should do in bed. You don't sit in bed and start reading. You don't sit in bed and be watching TV. And then you fall asleep and your TV is still on. So those are the 3 things to do in bed. Pray, sex, sleep. Diet is important. Dr. Ajibade, we want you to come tell us more exactly just what to prevent dementia. It's a lot of things we took in today, but what to do, steps to do to prevent it. I think prevention, we've all agreed, is better than cure or looking for cure. So without, belaboring that, I want to turn it over to you to give us your, closing remarks. And Dr. Izugu wrote here that undiagnosed and untreated sleep apnea can be a problem too, which is true. And, and Dr. Akitonde wrote that beetroot is excellent for brain function. Is that right, Dr. Ajibade?
Yes. So beets help the body. They help the body produce a chemical called nitric oxide, which is not only a vasodilator. It helps with the vasodilator means it helps to relax the blood vessels, but nitric oxide is also a neurotransmitter. It helps the brain cells communicate better. So it's very important for the brain. So yes, Dr. Akintonde is spot on.
Thank you. So Dr. Ajibade, actually answered my question on MCT oil. This was PubMed. This was published in PubMed that MCT oil does not affect total cholesterol, LDL cholesterol, or HDL levels, but does cause a small increase in triglycerides. So if it does that, and one does not have weight on them or have problem with sugars or blood pressure, then it won't matter. So then it's okay oil then. So kindly give us your closing remarks.
Well, again, thank you, Dr. O, for this honor to be able to speak to your audience. I really appreciate it. I also want to just use this as an opportunity to implore medical doctors and healthcare practitioners, especially people who look like me, which is pretty much everybody here, that we have to start pointing out to our patients and the people we serve, that's especially the Black community, that's there are some differences, and you want to point out that you can't just address them in the same way that you address white people, because in my opinion, I feel that we are running a 100-meter race. I feel that we're starting maybe 10 meters or 15 meters behind. So you have to address those deficits. And that's why we talk about some of the things we talk about. You have to try and address them. So at least we can start on equal footing. Most of the recommendations that are made on Alzheimer's disease, they just assume that everybody is the same. And unfortunately, most of the research that has been done has been on white men, not just even white men and women, but white men. So it's very important that we constantly think in terms of, don't just regurgitate what you read in the textbook or in the journals. You have to also think about your Black patients. And that way we'll be able to serve them better, and we'll be able to avoid, in some ways, the tsunami of mental health illnesses and dementia that are coming down the line. And again, it's going to affect Blacks more than whites, for sure. So I just really want to make that appeal to, and of course, you lay people out there who are not medical, please take the efforts to do the things that that need to be done when it comes to your own personal health, because you're different. Race is not skin deep. Let's put it that way. It's not just skin deep. It goes down to your cells. And that's it. Thank you again, Dr. O.
Thank you so very much. We appreciate you. Thank you.
Thank you.
Thank you, everybody. I think this has been, very educational. I pray that we make some lifestyle changes, because we need to safeguard our memories. So till we meet next week, please keep safe and keep happy.
When are you bringing him back, Dr. O?
It needs to come back right away, because I'm going to be honest, I learned a lot tonight, but I want the core. What do we do to prevent this? I want a list. I want a discussion on boom, 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 right? Dr.